Okay. Good evening, everyone. I welcome you to this lecture on communication skills for health workers. The lecture is under the module psychology. We have been having psychology. We have had 4 lectures so far, and this becomes lecture 5. I guess everyone has been following up. Okay. My name is Kato Alex Male, as usual. I'm a public health officer and I'm a researcher. And right away, we shall continue with the objectives of this lecture, and these include to define terms used in communication skills, the process of communication, effective communication and its importance and barriers in medical field, the key components of effective communication in the medical field, factors affecting doctor-patient relationship, and strategies to improve the relationship. The terms used as usual, like we do, communication skills itself refer to the ability to convey information effectively through the various means. The means include the verbal, non-verbal, and written means. And as for good communication skills, the listener must listen actively and must understand what the other body is, what the counterpart is saying. Communication as a process, it is the exchange of information, ideas, thoughts, or feelings between individuals or groups through verbal and other means of communication. That is the verbal, non-verbal, and then the written means. Another important term here is active listening. It is very important in the medical field, whereby you must fully concentrate on what is being said, understand the message being conveyed, and also respond thoughtfully to the speaker. This provides mutual understanding and clarity. The other term is effective communication. This is very, very important. In case communication is not effective, then there is no communication. So what is effective communication? It is the successful exchange of information between individuals or groups in a clear and concise manner, leading to mutual understanding and desired outcome. In other words, ensure that the person receiving your information understands it well. Make sure you use the language they can understand and try to limit certain words and statements that they do not actually understand. The other term is doctor-patient relationship. It is also very, very crucial. It refers to the unique and complex interaction between you, the healthcare provider, and your patient. It encompasses trust, communication, empathy, and mutual respect. And for this case, the doctor-patient relationship, you must show empathy to your patient. You must try to feel what they feel. You must try to put yourself in their actual shoes and try to make yourself go through. Think of what they're actually going through, and there you'll provide the best services to them, and you shall have improved the relationship. Empathy, as a term in communication skills, it is the ability to understand and share feelings of others. Then types of communication. We have 4 types of communication. We have the verbal, non-verbal, visual, and written communication. The verbal communication involves the audio. That's the audio communication. You're trying to say something to someone. Therefore, you must use a strong and confident speaking voice. You must be able to listen to what they tell you. In other words, like if someone is now giving feedback after listening to you, try to listen to also what they are telling you. In case you are the receiver of the message, you should also be able to listen actively. Avoid filler words in your communication and avoid industry jargons where appropriate. Try to avoid them. This is all to do with effective communication. Then visual. This is now like you're trying to show them something. You're trying to show your audience. You're trying to show your patient something. And that is the visual communication. Ask them before including visuals. Ask whether they are okay with your visual, or ask them whether they are okay to see what you're trying to present or what you're trying to show them. Therefore, consider your audience and only use visuals when they add value. Do not use them when they are actually unnecessary, when they don't have anything they add as far as the the medical context is concerned. Make your audience understand what you're showing them clearly, and make what you're showing them also easy to understand. The nonverbal communication, here you're not saying anything, but you're perhaps trying to portray using the body language. You're trying to portray, to convey your information, your message, using facial expressions or any other gestures that you can perform. For this case, notice how your emotions feel physically. Do not just convey any non-verbal communication, because you might convey according to your emotions. Be intentional about your communication and also mimic non-verbal communications that you find effective. For the written type of communication, we do a lot of writing in a medical field. We document almost each and every time. We start writing at the time you have received your patient. As you're trying to record the information at the time of reception, you're trying to communicate to that person who is going to admit them. But for you are just receiving them at the reception. Therefore, use a simple language that the person who is going to admit this patient can understand. Also, your patient can also, when this patient is re-asked this information at the point of admission, your patient can retrieve what they said at reception, and it is correlating with what you have written on their on that information on the information sheet, that on those record forms, on those forms that have the patient information. Do not rely on tone when it comes to written documents. Take time to review your written communication and keep a file of writing that you find effective and enjoyable. Under the medical field, you must keep, it is a must, you must keep these records for future reference. This patient might come back presenting the same symptoms, and then you administered a certain treatment to them some time back, and this time you want to change the treatment. So if you didn't keep such a record, there's no way you can know that this is such and such a treatment was administered in the previous time. The communication process, this includes a sender, the message, and the receiver. And then the sender encodes the message, that is the process of encoding, and then sends it to the receiver. The receiver decodes the message, that is the process of decoding. And once the receiver decodes the message so well, he or she will give a feedback to the sender, and that's when the communication process shall have been completed. This message is transmitted through what we call a channel, a communication channel. There are various communication channels that you can use. Still to continue with the communication process, the sender is that individual who is initiating the communication process, who encodes the message. Then the message, it is that information, the ideas or emotions that you are trying to transmit, you as the sender. Emotions are very, very crucial. Like I talked about them on the flow diagram. It is very, very crucial to deal with, emotions, because they are the ones that portray the body. They are the ones that control the body language, any gestures. In other words, they control the non-verbal communication. You get it? Yeah, and the message, the emotions are actually the root of the message that you convey in non-verbal communications. Encoding, it is a process of converting your message into a symbolic form that can be communicated. Yeah, remember, you have the message, you're thinking of that message, you're thinking of what you want to tell to your audience or to this patient. So that process of trying to make what you're feeling within you, trying to come up with something to tell your patient or your audience, is the process of encoding. The channel is the medium through which the message is transmitted. This can be a written document, that's a channel. It can be electronic document. We always communicate electronically. Currently, I'm also communicating electronically via devices, via social media and other media platforms. Then a channel can also be a face-to-face channel, whereby you're speaking to someone directly. Then the receiver is that individual to whom the message is intended. That person who receives your message is the receiver. The communication process still continued. We have also decoding as a term. I told you the receiver receives the message, then decodes that message. And then like that is the receiver tries to interpret and understand the message and then will give feedback where it is necessary. So the feedback is the response or reaction provided by the receiver to the sender. You get it, to show that they really understood or interpreted well what the message that they conveyed to them initially. The noise also has now as an interference. Noise is an interference or a distortion, and what it does, it hinders accurate transmission of the message. According to the flow diagram, the message can affect the sender. Noise can distract the sender, and the sender might not convey the intended message. The noise can also affect the very message, and it does not reach well to the receiver. Or the noise can also distract the receiver, and the receiver will not interpret the message well, and therefore we shall not have the communication process completed. And then a context, it is that situational factors that influence the communication process. Yeah, such factors we mean, for example, culture, or any social dynamics. The way you speak to someone of this culture is not the same way you speak to someone of another culture. You remember at the introduction of this module, we saw how culture is very important in determining someone who's understanding personalities and any other cognitive factors. Therefore, the culture of that individual with whom you're communicating influences a lot in the communication process. And these factors, including culture, any other social dynamics, that is now the context in the communication process. Another important fact are the strategies that you can use to ensure effective communication. In the terms when I was introducing communication skills, I put this term effective communication. So I guess members understood what we mean by effective communication. Any communication is effective so long as it is understood and the person who has received the communication tries to even provide feedback. You get it? Therefore, the strategies to ensure we have effective communication are summarized in 5 C's. The first C is clarity. You must be clear. The second C is coherency. You must be coherent in your communication. Conciseness. Your message must be concise. Consistency. You must be consistent in what you're conveying, in the information you're conveying, and also credibility. Clarity. This makes your message clear and easily understood by your audience. In other words, use a simple language, avoid jargons and slogans, and try to organize your thoughts logically. The take-home message here in clarity is using a simple language and avoid jargons. Someone cannot understand what you're telling them, but for you, you're continuing to tell them. And especially in the health setting, do not use those hash terms. Though that you want to scare your patients, you want to show them that you're actually good at the medical knowledge. So you try to use those hard language to scare them away. It will be meaningless because they have already feared you by the time they came to you to report to you their issues. So use a simple language so to ensure that the services are provided well. Coherency, this relates to logical connection between ideas. Your ideas must be logically connected, and also the message must be flowing so well. In other words, ensure that all points are connected in a meaningful way. Then conciseness, this emphasizes the importance of conveying information in a clear manner without unnecessary details. Yeah, only include important information in your message. Do not just put anything that you feel like. Only put information that you feel will help your patient or the person who is going to receive this information. That's conciseness. Then consistency. This involves ensuring that the message remains uniform in terms of tone, style, and content throughout the communication process. Everything should be logical and should also be flowing in a consistent order. In other words, one word connects to the other. You get it? Even you find out that even in my lecture series, like I have been organizing them. One lecture connects to the other to ensure that I'm consistent in my presentations. You get it? So the same way when it comes to the health work now, try to be consistent in the message you're telling your patient. Do not talk about this. You're trying to talk about something affecting their legs, and again, you try to talk about something that is affecting their stomach, for example. You get it? That is confusing them. Talk talk about one thing at a time, and please be consistent. As you're trying to talk about the anything affecting their stomach, try to put on only the necessary information, and it must be flowing in a certain correlation or in a certain order that is connecting. Then credibility. This is crucial for establishing trust and reliability in your communication. In other words, this involves presenting accurate information supported by evidence, expertise, and it must be ethical. If there is any way that you can provide reference to your patient, to the information you're telling your patient, give that reference, because they rely on what you're actually telling them. You get it? They will comply with your directions. They will adhere to your treatment. And if you tell them to come back the next day, they will. If you tell them to follow the dose, the dosing, to follow the dose of the treatment you're giving, they will follow it very well. You get it? I wanted to say the dosing regimen. Anything. Please eat food at this time and then take the tablets. Please do not take the tablets if you haven't eaten. They will follow what you tell them, and they will rely on your directions. That's the importance of credibility. So these 5 C's of effective communication, we have seen how they're very important in the medical practice. Benefits and barriers to effective communication in health. The benefits: we have improved the patient outcomes. Whenever you communicated to them so well, they will adhere and comply to your directions. It increases patient satisfaction. Your patients shall be satisfied with the way you have served them. Effective communication also promotes enhanced teamwork among the healthcare professionals, in a way that if you communicate well with your colleagues, you will easily connect with them. In other words, if there is any chance that you want to consult something, communicate well and they will direct you accordingly. Also, it will promote collaboration in service provision. The same way, collaboration will lead to reduced medical errors. Whenever you communicate, at any point that you don't understand well, you communicate to your fellows, you shall have reduced the medical errors. Then the barriers to communication, language barriers. Take an assumption you have been allocated to a healthy facility in a region that speaks a language that you don't speak. Remember, your clients are these rural individuals that never went to school, so they cannot speak an official language like English or Kiswahili or French. They only know that language they only know their local language that now you can't understand. Therefore, language barrier becomes a huge barrier in effective communication. Cultural differences, the same way. Culture is reflected a lot by language, is reflected by norms and values. It reflects a lot on the way, on the people, on the individual's personalities. Therefore, you who has just come in this new culture, you have this such and such a personality, and your patients have a different personality. Therefore, in case you don't try to learn their culture, the cultural difference shall affect the communication. And in other words, you will not have an effective communication with your clients. Then another barrier is the hierarchical structuring among the healthcare organization. Hierarchy means different administrative levels. This one, it is more of administrative and professional in the way of you want to convey some information to your bosses, to the in charge of that hospital, of that facility, to the executive director of that hospital. You want to communicate with them, but since you are just a nurse, you cannot go to them directly. You need to first pass through a certain procedure. You find out that because of this hierarchy, because of this organizational structure, by the time your message reaches the intended receiver, it is not the way you actually conveyed it. You get it? So it becomes a barrier, and your communication shall not be an effective communication. Time constraints, it is also a factor, a barrier in effective communication. Communication will be effective if your receiver gives you time to listen to you, they understand, and then provide feedback. So without enough time for that, communication will not be effective. This comes in a way of you, the sender, you shall not have confirmed whether your receiver tried to understand what you actually told them. You get it? But in case there was enough time, your receiver would have had the time to understand and also provide feedback. Um, then key components of communication in the health sector, we have 7 of them. One, a clear and concise language. We have talked about this. Your language should be clear and concise. Do not use big terms in a medical field. You want to show them that you actually you learned a lot of knowledge when you were studying nursing or midwifery. You want to show them that you were very good. You get it? Much as you show them, they will praise you that you are good, but they shall not have understood what you said. So use a clear and concise language to improve the health outcomes. Active listening, listen so well to what they are telling you. Give them time, and also when it's your turn to speak to them, also they should give you time. That's a component of communication. Empathy and compassion. I've talked about empathy. Try to feel what your patient is feeling, and this way you'll provide adequate services the way they are required. And also, compassion means building trust and rapport. A rapport is that mutual relationship between you and your patients. All these lead to a better patient outcome. Nonverbal communication, the way you structure your gestures and your body language matters a lot. Try not to scare them away, and try not to mock them. Mocking, you're trying to laugh around your patients, yet they are feeling bad. Sometimes these patients might even slap you from nowhere. They are feeling bad, and for you trying to laugh around. So any nonverbal communication that you're trying to convey around your patients, you should be, it is a crucial component, and you should be conscious. Body languages, facial expressions, and any other gestures, they play a significant role in trying when you're trying to convey empathy, understanding. You get it? Yeah. The other component is feedback. Encourage open communication and feedback from both the patients and then the colleagues. Yeah, the people you work with and also your very patients. Let them communicate openly to you, and in case they communicate to you very well, give feedback. Or in case you communicate to them very well, they should provide feedback to show that they understood what you told them. Confidentiality is paramount in maintaining trust and privacy in the medical communications. Confidentiality. Do not just speak anything that the patient has told you to anyone unless that person is an authorized individual. For example, they are caretakers or your fellow workers. You get it? Keep the patient information confidential and make sure that you're trying to attend to them in a private area. That is privacy. Do not attend to your patients in an open place. Clarity in documentation. Now you have worked on your patient and you're trying to document their issues. Be clear and do not confuse others. Do not overuse abbreviations like the way medical practice is happening these days. There are very many abbreviations. You get it? This might confuse the person who will actually admit this patient. We now go to the doctor-patient relationship, and a key issue to consider here are the factors influencing this relationship. Number one, communication. It must be effective. We have talked about this. Whenever there is effective communication, such a relationship between the patient and their doctors shall have been improved. Then trust is also a factor that influences this relationship. You must ensure that your patients trust you. This is when they will comply with your directions. They will adhere to your treatment. Empathy, it is also a factor that improves a doctor-patient relationship. Whenever you try to feel what they are going through, you will improve on the services you're giving them. Cultural competency, be competent at their cultures in case you have different cultures. Whenever you are allocated to a facility that is in a region that is not you're not used to, please try to be competent with their culture, such that you improve on the services and also improve on the patient outcomes. Time constraints, like we say, whenever there is time, we shall have effective communication, and effective communication will boost the doctor-patient relationship. Avoid personal biases. Whenever there is a bias, usually we have these cases whereby a patient reaches at the health facility and the patient is like, such a doctor cannot work on me. Perhaps the doctor looks like this or this. Such personal biases determine a lot on the health outcomes. Also, you as a health worker, avoid personal biases on patients. A patient comes in and you're like, this is a lady, I don't work on ladies. You get it. And such a bias, you don't give the required services. The other factor is decision making. This comes to the decision making capacity. Whether your patient has a proper decision making capacity or their caretakers, it should be there to improve this relationship very well. In other words, do not dominate at decisive stages, deciding on treatment to administer, deciding on the medical procedure. Do not dominate as a health worker. Also give a chance to your patients to decide, to take a decision on what procedure they should go through. Emotional intelligence, this is also related to the state of your patient. Are they intelligent? Can they make a good decision? You get it. Can they think of what you have told them and then respond accordingly? This is a factor in improving the doctor-patient relationship. Then the work environment, it should be a healthy environment, also to boosting this relationship. I guess we have understood the factors influencing the doctor-patient relationship. Now let us get to the strategies to improve this relationship. Strategies are now the positive side of the factors. You get it, eh? Yeah. Let there be effective communication. Show your patients empathy and compassion, respect and dignity. Respect your patients much as they are just patients and your health professional. Respect them. Then in dignity, like last time I explained, it calls for professionalism. Much as you want to build this mutual relationship between you and your patient, but protect your dignity as well. Protect your profession. Dress up like a professional health worker, a professional nurse, a professional midwife. You get it, a professional doctor. Act professional such that you will have improved the relationship between you and your patient. Respect them and also acting professional. Then there should be shared decision making as a strategy. We have seen that whenever you dominate decision making, your patients might you might choose an option that doesn't work well with them, and instead you will deteriorate the health outcomes. Ensure that you build the trust between you and your patient. We saw trust and effective communication comes with credibility. Try to provide evidence and reference where necessary as you're trying to communicate to your patients. Cultural sensitivity, you must be sensitive with the culture you're working with, such that you don't instead disrupt your patients mentally and also physically. Professionalism, I've talked about it. Act professional, dress up well, use the professional language, not the harsh language, but do not use abusive or offensive language with your patients. Follow up and continuity of care. Try to follow up on your patients. Try to invite them at your facility to check on which stages they have reached as far as their conditions are concerned. Continuity of care, even if they have actually cured from what you were treating, try to check on them at a moment in time. Then another strategy is patient education. Try to educate them of their condition. You can educate them on the symptoms of that condition, on any other aspects to do specifically with that condition. Let them be informed of what they are going through, and this will improve on the outcomes. You get it? Eh? Yeah. They also gain confidence. They will become confident of the condition, and they shall feel that they have conquered actually this condition. Another strategy is feedback. Try to provide feedback. whenever they have communicated something to you, and ensure that you get feedback to them whenever you have communicated something to them. In conclusion, this is now in conclusion to do with communication skills and then a good doctor-patient relationship. Yeah, such these two move together in the medical field. Therefore, good communication skills as well as a good doctor-patient relationship both contribute to better health outcomes since the patient will feel supported, heard, and respected. Thanks all for attending this lecture, and to those who are just watching online, thanks for watching. And this is the end of this lecture. The lecture was on communication skills for health workers under the psychology module, and these were the lecture objectives. Hope they have been achieved, and please learn more because when I'll be doing assessment, I will consider so much communication skills when it comes to this module of psychology. Therefore, give the attention, give this lecture the attention it deserves. Thank you. Let's meet next time.